Hello, I'm Dr. Stephen Olmos. I'm the founder of the TMJ and Sleep Therapy Centers. We represented a standardized protocol all over the world. We're in 7 countries, almost 65 offices, and I'm the originator of this type of delivery system, which is a conservative treatment for facial pain, jaw dysfunction, and breathing disorders. We will be doing weekly videos for the TMJ and Sleep Therapy Center's YouTube channel, and basically answering questions that people have. So please, we'll like you to let us know the kinds of things you're dealing with, and we'll try to give you some answers and help direct you in the right way. One of the first questions is, what is TMJ? So TMJ is a set of structures. The lower portion here is the mandible, and that's the part that opens. And this is the condyle right here. And this portion of your skull is the temporal bone, and that's what houses your ear canal and is the foundation for the joint. So TMJ means temporomandibular joint, and that's this structure here. Now, the conditions that arise from tissue being displaced or pain, arthritis, any number of things that can cause injury to the jaw joint itself, those are termed TMD, temporomandibular disorder. And there's a whole range of disorders that I would like to share with you. TMD is temporomandibular disorder, means any number of problems with the jaw, anywhere from tissue displacement, popping jaws, jaws that lock, inflammation, arthritis, metastasis of tumorous cells, any number of facial pain, headaches are all included with TMD, and including various conditions overlapping, nerve entrapments, trigeminal neuralgia. So all sorts of muscular and neural problems are termed in a TM disorder. Another question that's asked is, how does a person know if they have TMD? Well, if you have limited opening, you should be able to put 3 fingers into your mouth comfortably without issue. If your jaw makes noises, all joints should be quiet. Your elbow moves quietly, your jaw should move quietly as well. So if it's not, then ligaments in your jaw joint have stretched, and that makes it more likely that your jaw can dislocate or have issue with it. If it's tender, just if you touch the jaw and open it, it shouldn't feel any different than your elbow when it moves. But if that's inflamed, well, then you have a condition of irritation there, and that should be looked at. If your jaw makes irregular movements, that's because of displaced tissue or the muscles, and any type of facial pain, either upon awakening or throughout the day, are all related to jaw joint dysfunction, and you should have that looked into. Now, the origin of a lot of these problems can be what we call macro trauma. They can be from an accident. They can be from, let's say, a motor vehicle accident or a head trauma, anything where the jaw is forcibly pushed away from the skull and tissues are affected. Or it could be that people have never had those issues. Simply the fact of constantly moving the jaw while sleeping can stretch out tissue, make it sore, and then the person has to live with these problems during the day. If it's inflamed, it hurts just like anything else to load it. So every swallow, see, when a person swallows, their teeth come together, and that's the farthest the jaw goes up into the head. And if it's sore because it's been worn all night, then the inflammation is irritated, and that causes a person to lean forward. So people with jaw problems, they have base of skull and frontal headaches, especially as the day goes on. It worsens because of the irritation to the jaw. So if you're having these kinds of postural headaches, if you're having headaches that you wake up with, and perhaps you've even gone to the neurologist, they've done MRI, and they find that there's nothing organically wrong with your brain, well, then it may be one of the conditions I've been speaking about. And a lot of them overlap with breathing disorders. So if you have obstructive sleep apnea or nasal obstruction, these magnify the activities that happen at night with your jaw. Grinding your teeth is actually a medical problem. It's called a movement disorder. And that might be the mechanism for some of the issues you're having. So that's what we need to do. That's what we need to figure out. And if you're having any of those issues, then like difficulty chewing or talking, you should really get that looked into.